but it'll also, there we go. This event will also be recorded and put on our website by this evening. You will be able to see this event and go back and view it at any time. And so that is on our careerconnectors.org page. And I'll talk more about that at the end. But again, you'll be able to go back and see this whole thing anytime you want, or if you need to be reminded about it, people that were on the call. All right. So we're gonna get going. We are live streamed now. I will also probably be asking questions here and there throughout the event. And so watch your chat and make sure you're answering questions. We also are going to be giving away some gift cards at the end of the call today by just having you fill out a couple question survey. And so let's see, I think we're giving out $50 gas gift cards this time. I can't remember how many, maybe 4, but we're giving out a whole bunch of gift cards this time for anyone who answers our survey right at the end, and that will be right before we go to breakout sessions. And so, all right, Bree, if you could take us to the agenda slide. Here is the agenda, and I know it looks like a lot, but here's how we do these events. I will introduce each of the speakers. They're going to talk for a few minutes. The first one is our longest talk. Alexis is going to kind of give us an overview of healthcare, and then we're going to go into it. And it'll be about 3 or 4 minutes per speaker. We'll go quickly. And then, so be ready, take notes, ask any questions you have right in the chat. You can also directly message somebody, one of the speakers, and ask them a question directly. But then we will close it out around 10:15. We'll talk about how to get into our breakout rooms and launch those. And then we'll have about an hour where you can network directly with the hiring companies. All right, so let's get things started with Alexis Burdine. Alexis is the Communications and Development Manager for the Greater Phoenix Chamber Foundation. Welcome, Alexis.
Good morning. Thanks, Jessica. And thank you everyone for being here. I'm going to dive right into sharing the numbers behind our healthcare and social assistance jobs. And remember, you can find all of these slides on azcareersnow.com. All right, the good news is, moving along, is that it's a job seekers market. And there are a lot of jobs out there, especially in these industries. And we're going to move along and take a look at the latest 2020 data. So this is the most recent data we're able to pull from. And what we're able to find in general is that there's been a drastic increase in the number of jobs in Arizona. We had 2.8 million jobs. And you can see that a large portion of those are right here in Maricopa County. And as there's an increase in the diversification of jobs, there's also an increase in wages. So we love that. We love the salary increase. We'll go ahead to the next one. Speaking specifically about healthcare and social assistance jobs, these industries make up more than 10% of the jobs here, and wages in healthcare are higher than the general labor market's wages. So this means if you're working in these industries, you're probably getting paid a little bit more as well. And while entry-level healthcare jobs don't pay overly high, they start at about $16 an hour, you can quickly gain more skills and move up with just a little bit of short-term training. Okay, looking ahead. So what can we expect? We're projected to add about 600,000 jobs in Maricopa County alone. A huge percentage of those jobs are in healthcare. And we know that once healthcare jobs are created, they don't go away. So we can anticipate this number to grow larger, even further into the future. And moving on, you can see here that wages have gone up significantly. And of course, across many industries, we're going to continue to see this increase as we can continue to experience inflation across our economy. And that's pretty much just a standard trend that we're noticing everywhere. But moving along, if we look at healthcare specifically, and we already know it's trending in high wage, high demand jobs, we can determine that, of course, this is a growing field, right? Supply and demand. And so this is great news for you because there's an opportunity to enter this field, make a good starting living, and then the key is to move up quickly. And this is something that isn't always easily accessible in every industry right now, but because there is such a high demand in the healthcare industry, employers want to train you. They want to prepare you for that next level because they need people to fill those roles. And so what does this mean for you? It means you're going to continue to increase your skills and your salary. All right, so on the next two slides, there's a lot of information. So I'm only going to mention a few points, but you can review all of this info on azcareersnow.com. What I want to share is that there are a lot of different entry points into the healthcare sector. So you'll see that these entry points require different levels of education and training requirements. And when you go through these slides, you can assess where you're at or what's a good fit for you. And if you're not really sure, you can reach out to myself or to Jessica or anyone involved today, and we can help you figure out where your starting point is. But the good news is that there's always a starting point into this industry, and it's pretty easily accessible to everyone, regardless of where they're at right now. We could go through the next one. So there's just a little bit of information left there. And again, thank you so much for listening. I wish you the best of luck in your experience today. And we've talked a lot about training opportunities and upskilling and how that is the key to moving on to those bigger positions that pay a bit more as well. And what is unique about AZ Careers Now and what you're going through today is that when you speak with employers, you're going to have the opportunity to pick their brains about these free training resources and what they would offer to you or what you can do to move more quickly into this career. So I encourage you to not just talk about the job you would enter in today, now, but what that looks like in the future and how they'll support you in getting there.
I love that, Alexis. Thank you so much for being here. And again, if you go to AZ Careers Now, you'll see a drop down for industry. And if you click on healthcare, it will give you the data that Alexis just went through. And so one of the things I love about this industry specifically is that the career pathways are stable. So the jobs are pretty stable when it comes to not having to worry about layoffs, and so insignificant growth in Arizona. So thank you so much. We appreciate you being here today. All right, we are going to jump into our hiring companies. You guys get ready. Hold on, get your paper and pen ready. We're going to start with Cindy Soto, who is an HR analyst with the Arizona Department of Health Services.
Hello, good morning, everyone. My name is Cindy Soto, and I'm one of the recruiters that's going to be here with you today. We are going to have 2 break rooms for the Arizona Department of Health Services. So I am one of the recruiters here for Arizona Department of Health Services, and I do a lot of recruiting for our division in licensing. So as you can see, we have so many different divisions and so many great opportunities to offer you today. The ones that I'm primarily focused on is the licensing division. And then we have Tammy, which once we break out into the break rooms, she is more for preparedness. So as you know, our mission here is to promote, protect, and improve the health and wellness of individuals and communities here in Arizona. Arizona, definitely great opportunity and growing. And, as everyone and Jessica and everyone has said, definitely great opportunity right now to continue to promote and land that job. So as we go on for the next slide, as you guys can see, we are promoting our public health preparedness positions, which is our EPIs, our public health sanitarians. So a lot of different promotions here to go ahead and promote, as well as our public health licensing surveyors. So these are 2 of the ones that we will be promoting to, but definitely have a lot of opportunities if anyone just wants to have that dive in. But once again, the ones that we are promoting here will be with public health licensing and preparedness. So just some information for you guys to have in regards to how to apply for the opportunity and how to view other opportunities in our department. Benefits. So definitely love the state benefits, correct? We have a great education program, a great retirement program, paid time off. So definitely a lot of great benefits for joining state services. I know everyone will continue, or some people continue their education. We have a great benefit where they continue to promote and grow you in your career. And then last but not least, just our contact information. As I stated, we'll have 2 separate break rooms. I do the recruiting for our licensing division, and then we have Tammy that does our preparedness. Definitely entry-level positions that we offer as well, but this is just our contact information. So when we break down into those break rooms, I myself will be hiring for the surveyors, and Tammy will be hiring for like the EPIs. So definitely great opportunity to go into those 2 separate break rooms here that we have for the Arizona Department of Health Services.
Fantastic. Thank you so much, Cindy. Do you mind telling us real quickly, what is your philosophy on remote work? Do you guys do that, or do you have a hybrid opportunity?
So we do have hybrid opportunities as well for some entry-level positions. Unfortunately, with our surveyors, since they have to go in to the different areas, they don't have the remote options. But once again, yes, we do offer remote options for other opportunities, like our customer service representatives and things like that within our division. So yes, that opportunity is available, just not specifically for our surveyors.
Awesome. Thank you so much for being here today, Cindy.
You're welcome.
All right, we're going to move over to Jose Valdivia, and he is a talent acquisition specialist with Sun Health. Welcome, Jose.
Hi, good morning. Thank you for having me this morning. I'm from Sun Health. I'm the talent acquisition specialist. We're excited to be here this morning and share with you all of our openings that we have. We have 3 different communities. Our administration office is located in Sun City. So our 3 unique communities are in Sun City West, Litchfield Park, Surprise. We also have a Sun Health at Home program, where it's an admin program, but you travel throughout the community supporting our clients at the houses. And then we have the community support. We also have a foundation, so there's some foundation opportunities. All of these opportunities can be found on our website and on our career page, which will be listed on the next slide. And I've shared that with everyone in the message box. Here's how to apply in a lot of the different positions that we have across the board. I support system-wide, so I'm supporting hiring managers across the system, identifying talent in nursing, environmental services, marketing, HR, dining services. So our entry-level positions, our minimum wage is at $14.50 an hour. That would be someone with no experience, going into a server position or into housekeeping. We also have training opportunities and bridge programs. We have quarterly opportunities for training and professional development. We just finished an assistant caregiver program where they were put through a training program and then became certified caregivers. Right now, the highlights are the nursing positions, CNAs, LPNs, RN weekend supervisor, director of resident services. We're also looking for a community program, a care transition RN, and then we have some innovative positions to build an IT infrastructure. So there's a few high-level IT positions as well. And how to apply, visit the career website, and you can always also reach out to me. I provided my email address on the slide, and talent@sunhealth.org. So that's how you can reach me. You can follow us on social media. There's a lot of development for employees. So we have scholarship information. There's quarterly awards that are going out. We have nursing specific scholarships. We have a $6 million scholarship that we are managing and really looking for students that are interested in healthcare, that are looking to build those careers, that are looking to transition and look for an employer that will support that growth. So Sun Health is a great place for that. I encourage you to visit the sites and please reach out with any questions. And I look forward to meeting you in the rooms to answer any more direct questions of any of the positions.
Fantastic. Thanks, Jose. It's great to meet you and have you here. We appreciate your time today.
Thanks, Jessica.
All right, we're going to move over to Robin Ursland. She is a talent market specialist with Honor Health.
Hi, everyone. Good morning. I'm very happy to be here with you. And thank you very much for the opportunity as well. All right, so I'm gonna do my best with my, kind of 3 minutes here to make it kind of short and sweet and to the point. And certainly we'll have lots of opportunity in the breakout rooms after to have some, fun discussions. I'll make sure I drop my email address in there as well as also on the slides so we can have some contact with each other afterwards as well. All right, so Honor Health, we are a large hospital system, network here in the Valley. We're kind of what I consider and love to promote that we're kind of the hometown hero, per se a little bit. So we are a nonprofit kind of community-based, hospital system. We've got 6 hospitals, here in the Valley with us. And we also have a very large group of our, kind of medical practices. And those kind of range anywhere between primary, specialty, urgent care locations. They spread all the way out from, the Green Creek area, into the East Valley, West Valley, and also even up into Prescott. So we're kind of certainly, growing our footprint here in the Valley well. And that means there's more job opportunities. Many of you may be looking for that more direct patient care, type setting, and some of you may be interested in more remote care. And certainly we have those different types of opportunities as well at the different locations with us. So certainly from a nursing standpoint, we do have 5 of our hospitals are magnet recognized as well. We've got 3 level 1 trauma centers. So some folks that kind of like to work a little bit more in that setting, certainly I kind of can help guide you to where those opportunities are, as well as also just kind of adding a little bit more about Honor Health and the culture here with us. We have a deep rooted, longstanding, partnership with Desert Mission, here in the Valley. So lots of great opportunities for folks who like to kind of dial in and really give back to the community in that setting, as well as also our NOAA partnership, which I'm glad I think that there is the gentleman on the line here with us from NOAA. So he can certainly at some point be able to dial in with you with career opportunities more directly with them. All right, and next slide, please. All right, so to talk a little bit more about locations, certainly Honor Health has lots of different career opportunities. Our career site is honorhealthjobs.com. You can certainly kind of filter by location. So if you are, someone who's more in the West Valley, areas, you can certainly kind of select and filter through those city locations to see job career opportunities there. And here's kind of a little bit of a map so that you kind of have a little bit of an idea and a concept where we are, in the Valley as well in different locations. And here is just what I will say kind of a snapshot of the different opportunities with working with healthcare can afford you. So certainly kind of, right off the bat, we have amazing benefits, take care of yourself, take care of your family, kind of support you, if you're looking to kind of carry on, through, your education goals. We offer the $5,250 for anyone who's full-time or part-time with us for tuition assistance. And that can be in the form of upfront payments or even kind of a reimbursement, type scenario. We certainly have different types of shifts. So if you're kind of a night shift worker, a weekend worker, we certainly have different variety of different roles that offer that opportunity for you, as well as also we're offering some nice transition incentive bonuses, currently at this moment, if you join us in full-time and even actually some of our part-time, roles as well. So I'd be happy to kind of talk through what that may look like for you. It may kind of depend on the role. But as far as who we are hiring now, as you kind of see a little bit of a snapshot of the list, we've got many different types of roles that we're hiring for, nursing roles, nursing support roles, patient care tech roles, transporters, our support services, housekeeping, food service, certainly kind of our allied health roles, respiratory therapists, physical therapists, the medical assistants that are, supporting the care practices out at the urgent and primary care settings, as well as also a lot of our support services areas that are a bit more, not so much, forward facing from a patient care standpoint, but they're, our revenue cycle, our customer service navigation coordinators. We've got many different types of roles that you can certainly kind of work into healthcare if you maybe don't necessarily want to be direct with patients, but you want to kind of work in the healthcare field. Lots of different types of opportunities, whether if it's IT, finance, supply chain logistics. I'd be happy to kind of help anyone kind of guide you to those opportunities with us. And I think the next slide has my contact information on it. Yep, there we go. I will share with all of you as well if you want to join over in the breakout room. We are hosting a separate hiring event next week. So if you are interested in learning more, please dial in with me or feel free to send me an email. And thank you all for your time today.
Thank you, Robin.
Sure.
All right, we're gonna move over to Adelante Healthcare. Shelly Spence is here, and she's the Talent Relationship Manager.
Yes. Hi, good morning, everybody. I appreciate your time today. So Adelante Healthcare, we are a nonprofit organization. We are what's considered federally qualified community health, and we are integrated preventative health care. So think of going to your primary care doctor. We provide internal medicine, family medicine, pediatrics, OBGYN services, as well as behavioral health and dental. Now on our next page, you can see some of the positions that we are staffing for. So we are growing. So we are looking, of course, for medical assistants. We're growing our registered nursing staff. We're also looking for registered dietitians, behavioral health techs, and behavioral health consultants. Of course, medical front office, and then our corporate positions, which are going to be IT, marketing. We have positions in our call center and our community health team as well. Now, we do offer quite a good amount of benefits to go along with that. So we offer, of course, our medical, dental, and vision that's available the first day of employment. We also have a health savings account that we do add quarterly into that you can also match as well. We offer paid time off. That's going to include vacation, sick time. We also pay for short-term and long-term disability. Now, we do want to invest in our staff members to help them grow in their career. So that's going to include a reimbursement of up to $2,500 annually for tuition, any lab fees you may have. But we also do job development, and that job development is going to consist of any sort of webinars, trainings, certification programs to help you grow within your career. We also want to promote that work-life balance structure, as we all learned over the last few years how important that is to everyone. So we do have our company pay 10 holidays per year. We have 2 days a year where you can do community service time as well. And then if you do want to get a hold of us, we are available at adelantehealthcare.com, or if you want to email directly, we're available at employment@adelantehealthcare.org. And we would love to hear from you. Any questions you may have about current needs, future needs, we're always happy to answer that for anyone.
Wonderful. Thank you so much, Shelly.
You're very welcome.
Yeah, something I keep hearing you guys say is training, certifications, development. So these employers are really interested in hiring staff that are interested in staying and developing them in their profession. So I love the career, what we call career pipeline, career pathway jobs, where you can come in, get started, and then you can grow your career with these companies. So another great example of that. Thanks, Shelly. All right, we are going to hear from NOAA, the Neighborhood Outreach Access to Health. This was a new company to me, and I love learning about it. So welcome Alan Riggs, who is a senior recruiter.
Thank you. Thank you for having me. So NOAA's actually been around for quite some time now. We've been partnered with Honor Health, and then we branched off on 1 January due to our growth to become essentially our own entity. So as the slide says, from Scottsdale to Glendale, we literally have healthcare facilities that are all the way across the valley. We're currently building a new facility in Scottsdale, which is going to be located or currently located at McDowell, the 101. What we do is as our mission here states, we provide compassionate, quality healthcare to our community. We believe in improving the healthcare of our neighbors, and our vision, as you can see, is to be a community health leader, providing accessible health and affordable healthcare, offering patient-centered and compassionate services. And I want to talk about that a little bit. What we do is our organization, the way we are set up is to be patient-centered. All of our facilities provide dental, medical, and behavioral health services. In addition to that, we also have community resource specialists that if during the time that our patients are there, we discover that income is an issue in being able to provide them with healthcare, we have our community resource specialists who can assist them in getting set up with what they need. So we are a federally qualified health center. So what that means is that our employees can qualify for the HRSA loan repayment program. And that's important because student loans are expensive, becoming a provider is expensive, and qualifying for that HRSA loan repayment with us is a wonderful thing for you. So with us, of course, everybody, we have benefits. We're kind of known for our benefits. We're actually a wonderful benefits program. And one of the things that I want to make sure everybody looks for is if we go to the next slide. We mentioned our providers here. We are looking for physicians, physician's assistants, practitioners, dentists, all behavioral health, dietitians, practice administrators, medical assistants, dental assistants, but we also have support roles. We have support roles that are available as well. In order to apply, what you would need to do is you need to go to noahelps.org and just go to the About Us and look for the Careers and Employment tab. And why I became part of NOAA is when you're part of NOAA, what you do is more than just a job. What you do is meaningful, it's impactful, and it matters. So if you want to be part of something that matters, then be part of NOAA, because what we do has direct impact on our communities. So if you have any questions, I could talk more about it in our breakout sessions. Here's our contact information. So go to noahelps.org. Becky is my manager. She's not able to be here with us today. If you need to contact me, please feel free to reach out to me in the breakout rooms, and I can get the direct contact information for you. Thank you.
Awesome. Thank you so much, Alan. Sarah says that she saw the new NOAA facility being developed. It's right by our house, and she said it looks great. That's pretty cool.
It's wonderful.
Awesome. All right, employers, you are killing it on your time. Thank you so much for getting through these presentations and helping everyone understand what is going on in your companies and your communities. All right, next we'd like to welcome Nathan Bosworth. He is a recruitment specialist with Evolved MD.
Hi, hope you all are doing great. So what Evolved MD is, we are a organization that places clinical therapists in already existing primary care offices. We were founded by Eric Osmond and Steve Belgian. We wanted to create an organization that was mission-driven and people-focused. And to do that, we learned that by embedding our therapists into those physicians' practices, we are able to create more access to individuals who are looking or needing those behavioral and mental health services. As of June of 2022, because of the model we utilize and the partnerships we have with our various primary care physicians' office, we were actually able to create and provide access to over 730,000 patients that prior to this had not had that access. Currently, we are focused primarily in the Arizona area, but we also do have some locations in Utah. If we can go to the next slide, please. So currently in the Arizona area, we have open positions in our Cave Creek, Chandler, Flagstaff, Gilbert, and Tempe partnerships. So Evolved MD has both full-time and part-time. And in order to maintain a healthy work-life balance and that self-care that is a huge part of Evolved MD's culture, we actually place our therapists in clinics that are within a 15-mile radius of their homes just to limit that burnout of drive time. So if you see a location on here that you're interested in that may be a little outside of that, please feel free to reach out to us still. We do have other clinics that are constantly coming in as we grow. Some of the benefits that Evolved MD provides is for anybody who is currently licensed at an associate level or just finishing up school, getting prepared for that. We do offer free clinical supervision for our associate level therapists. We have our standard medical, dental, and vision benefits. We also have technology allowances, 208 hours of paid time off throughout the year. One of the big things I always like to talk about with Evolved MD is that we are, as I said before, focus on self-care. It is actually part of our bonus structure is maintaining your own self-care and ensuring you're taking care of not just what you need to do for work, but taking that time off you need and taking that time every day just to focus on yourself and kind of maintain your work and your home life. So again, currently we are constantly growing. We are spreading throughout the Arizona area. So if you don't see any positions on here in the location you're looking for, please feel free to contact us in these breakout rooms and we will talk more about where our growth is going.
Fantastic. Thank you, Nathan. A couple questions. I know we have some master's level, master's degrees in the different counseling degrees on the line. Do the people that you hire need to be fully licensed? Can they be associate counselors, or do they need that licensure at all?
An associate level licensure is acceptable. They must have completed their program and have gotten that license or be within 90 days of getting that license.
Okay, awesome. Thank you so much for being here. We really appreciate you.
Thank you.
All right, Joanne, we have Banner Health, which has probably touched all our lives in some way, some shape, some form. So please help me welcome Joanne Torres, the recruiter with Banner Health.
Hello, I'm happy to be here. I'm a registered nurse, I'm a recruiter for Banner Health and have been with Banner for over 30 years. I currently recruit RNs and RN new grads in the Phoenix metro area facilities. So next slide. I'd like to start with an overview of Banner Health. As one of the largest nonprofit hospital systems in the country, Banner Health is recognized for the quality clinical care consistently provided to patients in our hospitals, urgent care centers, and clinics. Our community, our commitment to communities we serve includes charity care programs for uninsured, health professional education, and research activities. Founded in 1999, and in the past 20 years, we have rapidly evolved into a fully integrated health system with comprehensive portfolio services. With more than 50,000 employees, Banner Health is the largest private employer in the state of Arizona. And in Colorado, third largest employer in the Front Range area of Colorado. So Banner Health has locations in 6 different states: Arizona, California, Colorado, Nevada, Nebraska, and Wyoming. So healthcare jobs included here are just an example of the few opportunities that we have, and opportunities in other areas such as finance, IT, supply chain, etc. So as far as locations, we are talking about Phoenix metro area, East and West Valley, Tucson, and Casa Grande. So requirements can vary with some of these positions. BLS certifications, for example, are in licensure, and we also provide many entry-level opportunities. So Banner Health offers training and education. Simulation Center for Nurses is one of those examples. We do offer full and part-time as well as registry opportunities. We offer transfer and promotional opportunities for internal learning and development to enhance your skills. We have a night and a weekend shift differential. We offer flexible scheduling and a comprehensive benefits package. So next slide. Applying online is the first step to your new career with Banner Health. You simply go to bannerhealth.com/careers, select the healthcare opportunities. Right below that, you'll see positions, and you would click that. And you can use keywords to filter and narrow your search by job and by location. You click the job to view the job description, and then you click the blue button to log in and create an account, or if you have an account, simply just log in. So you please be prepared to provide a resume, licensing information, and certification information for various positions. Next. So that is it in a nutshell. Thank you for allowing me to speak with you today. If you have any additional questions, feel free to contact us at employment@bannerhealth.com, and come join Amanda Johnson and myself in the breakout room. We would love to talk to you.
Fantastic, Joanne. We had a question here about behavioral health. Do you have any behavioral health positions available?
Oh, absolutely. We have a behavioral health hospital with Banner Health. And so with that, we have behavioral health therapists, we have RNs, support, all kinds of positions with behavioral health. Absolutely.
Awesome. Thank you so much, Joanne. All
You're
right.
very welcome.
I would love for all of you just to engage for just a minute. So tune in here. If you have ever been served in some capacity by one of the employers that we have on the line today, not necessarily by employment, but by health services, could you just drop a 1 in the chat? We'd like to see kind of if any of these companies has had an impact on your lives. Great. Yes. Me too. Absolutely. There you go. See, I love to do that because the impact of what healthcare does to Arizona, just to the nation, but to our community in Arizona, the impact is significant. And so it touches everybody's lives. And so I really love doing this event. So we can see that these are jobs that people are called to serve our community so that we have a better and stronger community. So next, I'd like to introduce you to Amy Clifford, and she is the Talent Engagement Specialist with the Mayo Clinic.
Thank you. Thank you. Next slide, please. I just wanted to introduce myself, Amy Clifford, and I'm part of the talent engagement and sourcing team here at Mayo Clinic, and I'm excited to be with you all this morning. We will be having a breakout room as well, and we're hoping that you'll stop by. I wanted to first start by sharing a little bit more information about Mayo Clinic. We are a not-for-profit integrated health system. We are thrilled to have received some additional industry accolades this week. The new U.S. News and World Report again for 2022 has ranked our main hospital in Rochester, Minnesota as the #1 hospital in the U.S., as well as for the 10th year in a row, our hospital here locally in Phoenix has been ranked as the #1 hospital in Arizona. There are several reasons we remain #1. However, one is our people who work at Mayo Clinic. Many of them live by the mission of the organization we have here, which is the needs of the patient coming first, which keeps us in a category of 1, and we feel incredibly honored to work here. Next slide, please. To share a high-level overview of Mayo Clinic, we have 3 main campuses in the U.S. Our main campus is in Rochester, Minnesota, and we have 2 southern sites, one in Jacksonville, Florida, and of course, here in Phoenix, Arizona. But we do have several other facilities in and around Minnesota and Wisconsin, which make up part of Mayo Clinic, which allows us to have over 73,000 employees that work for our health system. One exciting note that I wanted to share locally here is our hospital on our North Phoenix campus is growing and expanding. We are setting out to add an additional 1.4 million square feet of new construction, as well as adding to our existing facilities. Our new construction will add close to 100 new beds to our already 300-bed hospital, as well as adding 2,000 new positions, which is super exciting and why we want you to stop by our breakout room. Next slide, please. With all the expansion and growth in Arizona, we have several career opportunities in a wide variety of areas, including nursing, nursing support, medical assistance, environmental health, and housekeeping, and of course, administrative support. In fact, one of our hiring groups from our high growth areas is going to be attending the breakout sessions. So we encourage you to come by and talk to our hiring manager. Next slide, please. If you're not able to attend the breakout session, please consider joining our talent community. On this slide, there's a QR code. Please put your mobile phone camera up to the code, and it should hyperlink you to our website to sign up and join our talent community. What that is you will receive email alerts about our upcoming jobs or our recent job openings. And hopefully that way it will be proactive in alerting you to many of our wonderful opportunities we are going to be having here as our campus expands in Arizona. I sincerely thank you for your time and hope to see you in our breakout session later today. Thanks so much.
Thanks, Amy. Amy, did you say 70,000 employees for Mayo Clinic?
Yeah, throughout our health system, we have 70,000 employees.
I remember somebody telling me once, so many people think Mayo Clinic is only for like the rich and wealthy. And it's like, Mayo Clinic serves everybody. And so you just saying 70,000 employees, I think that really gives us a bigger view and understanding of the impact Mayo Clinic has.
Yes, it does. Thanks so much for having us. We're super excited to be here. Thanks, Jessica.
Awesome. Thank you so much, Wendy or Amy. And we're going to move over to Abrazo Health, and Wendy Fitzpatrick is here. She's a recruiter with Abrazo. Welcome, Wendy.
Good morning. Thank you so much. We're happy to be here. So I'm Wendy Fitzpatrick with Abrazo Health. Our parent company is Tenet Health. Next slide, please. We have 13 facilities here in the Valley. First is our Arizona Heart Hospital, repping them again today. They are downtown at up Highway 51 and Thomas. They're going to do mostly heart. Next slide, please. We have Abrazo Scottsdale, and that's at 40th Street and Bell. Next slide. Arrowhead is right off the 101 in Glendale. Next one. Central, we have in Central Phoenix off of 19th and Bethany Home. Next one. And our Abrazo West, and it's also one of our largest. It is a level 1 trauma center as well, right off the freeway as you're headed out of town. Next one. We have our Surprise campus. We're building a sister campus to that in Buckeye. You'll see that soon. Next slide. We also have our micro hospital, Abrazo Cave Creek in the Cave Creek area. Next slide. And we have transition to practice opportunities. We have nurse extern programs. We have clinical rotations at most all of those facilities. So we have partnerships with a lot of the schools in which you can come and, do your rotations with us. You can tour our facilities. You can complete the externship, transition into our RN new program, which is super exciting. We build pathways for you to continue your education and development. So you could start, let's say, as a medical surgical RN, we will give you the education and build the pathway for you to be able to become a CVICU nurse. If you want to move into the emergency department, maybe you wanted to work in transport and move our patients, and then you decide you find something in physical therapy, we'll help you build a pathway in that education, provide tuition reimbursement, different supports, be very flexible with your schedule. We have such a great education team. They come in, support all of our hospitals. Like I said, we're always growing. We're also nationwide. Next slide. So we are hiring new graduates. Like I said, a lot of the externships and new grads are going to start in a med surg and tele. However, I know that for people that are interested in labor and delivery over at Arrowhead, I believe we hired 6 new graduates the last rotation. But we have opportunities at all of our hospitals, including Arizona Heart. If you have a passion for hearts. Next slide, please. Fantastic. So this is our QR code as well. If you can't make it to the breakout room, you can definitely link to all of our jobs there at all of those campuses as well. We have jobs in environmental services, which is going to be kind of like housekeeping, cleaning the rooms, hospitality. We have food service. We've got bedside therapy, respiratory, laboratory, phlebotomy. All of those kinds of things, including surgical techs, nursing, leadership roles, admin, support roles. We do have some remote roles. A lot of them are going to be mostly on campus. And I think that that's kind of what we like to say that we do best is our culture and our company is amazing. We love our teams, our managers. They're always providing extra support for education. We have lots of benefits as well. Next slide. We've got sick time, we've got education and career pathways, tuition reimbursement. The benefits will include the typical medical health. We've got spa discounts, gym discounts. You get all the mental health, the fun, self-care things as well. You have a collaborative team that's there to support you in every way. We have events on the hospitals. We come to the floors. We have, salsa cooking contests, all kinds of things. It's a fun, wonderful environment all over the Valley, also in Tucson and across the nation. And next slide. And then that's how you can contact us. That's our job board. That's my name, my email address. You can email me anytime. I'm always happy to answer questions, anything we can do. Thank you,
All right.
guys.
Thank you so much, Wendy. All right, we are going to move on to Spectrum Health. And Spectrum, we have Tanya Nolan, and she is a human resources recruiter. Welcome, Tanya.
Hi there. How's everybody doing today? My name is Tanya, and I'm from Spectrum Healthcare. And I have a short video for you to watch today that talks about what we do here.
Spectrum Healthcare is a nonprofit integrated care medical group committed to providing unparalleled access to high-quality, compassionate care for mind, for body, for all of you. At Spectrum, we are committed to providing complete healthcare, including primary medical care, behavioral and mental health, and pediatric care. Most medical institutions separate behavioral and physical health care, but we combine them into an integrated approach that brings the mind and body together. This approach has paid off. In 2016, Spectrum was recognized as a Center for Excellence in Integrated Care by Health Choice Integrated Care. Spectrum Healthcare has been providing high-quality health care throughout Yavapai County for more than 65 years, and we are committed to helping everyone who needs care. Spectrum accepts patients across all payers, across all populations, and across the lifespan. This includes access, Medicare, and private plans. Today, we are focused on expanding our whole healthcare services to multiple sites across Arizona, including the Verde Valley, Prescott area, and now in Maricopa County. Care is not limited to our office locations, however. With our new Anywhere Care program, we can deliver award-winning care when, where, and how you need it. At the curb, in your home, virtually, or in person. At Spectrum, we truly put you and your loved ones first. To start getting award-winning care, schedule an appointment today in person or with a call. We look forward to helping you soon. Spectrum, for mind, for body, for all of you.
As you can see, Spectrum Healthcare is focused on integrated care, which includes both the mind and the body. So this is something that's really big for us, where we put everything together, where you can come and you can go to your primary care doctor, and you can also go to behavioral health at the same place. Some people are a little bit uncomfortable walking into behavioral health, so we put all of our services together, so you can walk into one building and not worry about what other people think about you. So that's pretty cool that we are able to do the integrated approach. You can go to the next slide there. If you would like to apply for Spectrum Healthcare, you can go to spectrumhealthcaregroup.com, and then you hit the search search open jobs tab there, and you'll see that we have over 65 openings right now. We are expanding all across Arizona, and we are just opening up over into the Grand Canyon area. So we're actually going down to Havasupai, and we're going down to Tucson, and we're going into Yuma, and we're trying to get to all kinds of different rural areas. So if you live in one of those rural areas and it's hard for you to get a position, we would love to hear from you. So we have many, many different jobs. We have anywhere care, behavioral health, case management, DSPs, therapists. You can be master's level, or you can be independently licensed. We have peer recovery specialists. We have data entry clerks. We have all kinds of different positions, and they're all statewide, and some of them are remote. The really cool thing about our anywhere care positions and our care manager positions are you can start from home, and then you can do your job out in the field. So you don't necessarily have to come into an office environment. But we do love, love, love building our teams. So we encourage teamwork, and we really work together, and you have so much support here. Is absolutely wonderful. Our CEO has actually been out in all of our clinics. She is a behavioral therapist, and she's a CEO. She's a nurse as well. So she is literally hands-on. And when she sees a need, she makes it happen. So that's what's so cool about working for Spectrum Healthcare. We have many benefits. They're similar to what we've heard already. So we have dental, vision, long-term disability, 401k, tuition reimbursement, and holiday pay. We also offer a wide range of voluntary benefits, CMEs for medical providers, licensure reimbursements, and many, many other types of benefits, including fitness memberships as well. Okay, you can go to the next slide there. And then if you'd like to contact me, this is my email. This is my direct email at hr@spectrumhg.org. And you can go to spectrumhealthcaregroup.com to look at our openings. And we're also going to have a breakout room as well.
Awesome. Thank you so much, Tanya. I love hearing all of you guys talking about your flexible work schedules and work life and different options, because I think that's one of the things about healthcare is that people don't understand that there is flexibility, even patient-facing jobs, that there is flexibility within that in some fashion. And so I really appreciate that I've seen that flexibility, especially over the last couple years, where we've really had to get creative. And so thank you for sharing some of that. Appreciate you. All right, we're going to move over to Orion Care with Dale Link. He is a Pathways Advisor. Welcome, Dale. Dale, if you're talking, we cannot hear you.
Yes, I was trying to be polite by having my mute on. Well, no, again, thank you so much for inviting us and giving us the opportunity to share. Thank you to all of you who are still on and watching and engaged with us. And it is exciting to hear about all these other industries out there that are providing such wonderful opportunities, not only for patients, but also for employees. So, wow. Well, again, I am Dale Link, and I am the Orion Care Pathways Advisor for Orion Care Solutions. Our mission is to do the right thing always. And we do provide services across the Valley, primarily, in the Valley, but also around the state in some rural communities, all the way down to Tucson, up to Prescott Valley, Show Low, Pine Top, Lakeside, and other places around the state. We do serve proudly about 4,000 members, and these are our disabled folks across the state. We do have about 4,500 employees as well. Many of them are the caregivers, and primarily today we'll talk about some of those caregiving positions that we're hiring for, but like many other organizations you've heard from, we also have other positions available. We offer hybrid models of employment, remote employment, and of course, in-person home care for our providers. So they actually travel, our providers travel to the homes of our members to provide services there. We also offer, like I've heard a few other companies, many growth opportunities. So that's primarily what I do. So I'd love to share with you some of the things I do when we hit the breakout room. So we have this amazing ABA cohort that I host with our interns and externs from schools around the Valley. We also offer ways to grow in this industry. So for example, we've taken interns, hired them, providing habilitation services, taken them up to earning their registered behavior technician certification, which is a nationally recognized certification. We offer tuition discounts and scholarships. So we've had employees earn their master's degrees and go on to become board certified behavior analysts, all starting from internships. So again, I'd love to talk to you more about those opportunities in the breakout room. But on our next slide, want to talk a little bit about some other benefits working with Orion Care. So like some of the other companies you've heard from, we do offer flexible schedules. So if you're looking for part-time or maybe working up, we have buildable hours. So if you start out part-time and want to go full-time, we can work with you on that. It is flexible. So if you're like a current student or you currently have a full-time job, but you're looking to supplement your income, or you just have this passion to help others achieve their goals, we can put together a schedule that fits your schedule and put something together that you can then help other others. So we do have a lot of opportunities for growth and just kind of gaining experiences. We offer services for developmentally disabled individuals in our DDD department. We also have an individually designed living arrangements, or IDLA. This is for those individuals who are 18 years, our members who are participating in this. You would provide services for these individuals in the IDLA setting. These are individuals who are 18 years or older. They've chosen to live on their own. And so you could help them become more and more independent through that process. If you have a passion to help the elderly, we have the elderly and physically disabled department. And then of course, we have the private home care division as well. So this is for those individuals who can't qualify for services through like DDD or through the traditional insurance models. So that is available for those people. And again, there is a QR code there. So if you'd like to learn a little more information about some of those services that we provide, some of the departments and opportunities, you can click that with your smart device. And finally, we'll kind of go to how do you get a hold of us? So I'll pause here for a second. That QR code will take you to our job portal. So you can learn about all the opportunities that we have, the openings we have, and also just to learn a little bit more about what we do, and you can get into contact with some people there. Now, again, I'd love to see you in the breakout sessions so I can share maybe some of the details of some of our college partnerships. Again, some of our pathways, opportunities to help you grow within the industry, and talk about what it's like working in this environment, which is, again, I think I heard in another presentation, there's that work-life balance. Orion Care is kind of like working in a family. I like that analogy. And again, going back to our mission to do the right thing always. It's kind of an exciting place to be. And so if you'd like to learn more, I'd love to share with you in the breakout session, and that'll be in about probably 10 or 20 minutes, something like that. So again, I'm Dale Link, Orion Care Pathways Advisor, and looking forward to seeing you in the chat, and enjoy the next few presentations.
Awesome. Thank you so much, Dale. We appreciate you guys being here. I have had a couple direct messages on our chat about this call and the links that are available. And so I wanted to let you all know that after this event, if you're registered, which anyone attending should have been registered, you will get an email that has all the links to these job boards for every employer. So I know they're dropping them in the chat. They're also on their presentation, but you will get a direct email that has the direct link to their job boards. And this webinar will also be posted on our website, so you can go back and review it at any time. All right, we have 6 companies to go, and then we will be in the breakout session. So I would like to introduce you to Tanya Diaz. She is a recruiter with Equality Health. Welcome, Tanya.
Thank you. Hi, guys. My name is Tanya Diaz. I am a recruiter here at Equality. And the way that I like to start off the conversation with all candidates I interact with is, what is Equality Health? So we are a value-based healthcare company. And what does value-based mean? So we're essentially the middleman between providers. So those are your doctors, nurse practitioners, PAs, anything you would find in the healthcare setting or hospital setting. And then the other side is our members. So those are individuals that have access, Medicaid, Medicare. That's our bread and butter. So right now we are Arizona based, but we're in 3 markets. We're in Arizona, we're in Texas, and we're gonna be in Tennessee in the next couple months. We're wanting to be in 7 states within the next 3 years. So what that means to you guys is we are growing and expanding. We haven't IPO'd yet. So again, what that means to you guys is that we are gonna keep growing, get ready once we go public. So right now we are a private company. So going to our slides here, vision and mission. So our vision is a world where everyone has equal access to quality healthcare and achieves optimum health. Our mission is to ensure all people receive quality healthcare that improves and enriches their lives. Next slide. Awesome. So our core values and beliefs. So we believe in social justice, we believe in health equity, and we believe in cultural integration and connected communities. As I mentioned, our bread and butter being those members that utilize Access Medicaid and Medicare. That is definitely more of a community-oriented process, and that's what we try to envision in just our workforce, like our employees, to have similar attributes, right, with ethnicity, with languages, and all that good stuff is what we like to portray. Next. So some of our benefits here, the one I really want to make a call out with is we have about 23 days paid PTO. But besides our PTO, our employee referral program is one of the best ones that I've heard any company have. We are paying between $1,300 to $2,000 per employee that you refer. So we have a lot of employee referrals. And of course, as you may know, retention is a lot higher once you refer somebody to our company. So if you do become employed with us, that incentive is huge. We do have that 5% company match for the 401k as well, which I like to make another call out for. Next slide. So here's a couple of our job opportunities. I wanted to just kind of call out sectors or departments. We hire in IT space, we hire, we have corporate strategy and development space, we have coders, we have credentialing department. I know a lot of people tend to outsource that, but we have that all in-house. And like I mentioned before, we do also have doctors and staff. So we have RNs and staff, we have nurse practitioners and staff. And the reason why we have that in staff is because that's the value we're adding to those members. So when the members give us a call, we have everybody that they need in order to get any problem resolved and triage any medical condition they may have as well. Next slide. So here's our website. If you do want to apply directly there, we did just get a LinkedIn platform. So now you're going to be able to find all of our jobs on LinkedIn as well. I would encourage everybody here to definitely add me on LinkedIn, as I am very responsive to anybody that reaches out. And then the integration between our ATS system is going to be wonderful coming up here in the next couple of weeks. So anytime that people send me emails, it's going to go directly to me via my ATS system. So I am currently the only recruiter at Equality Health, and I will be in the breakout rooms. But what that means to you as well as a candidate, I know and I'm fully aware of all the jobs and openings that we currently have. We have about 100 openings, 70 of which are newly created roles. Again, going back to that growth and expansion, a lot of times we just don't know because we didn't know we needed something until now. So it's very exciting time to join Equality Health. We've been around for about 5 years. We have about 220 employees. And I did want to make a quick little tidbit about 60% of our staff is hybrid, 30% is remote, and 10% is in office. So we are located in 16 states in regards to having remote employees. So if you have any additional questions, please join the breakout room later today.
Wonderful. Thank you, Tanya. Appreciate you being here. All right, we are going to move now on to Aurora. Nicole Campbell is the recruiting manager for Aurora Behavioral Health. Welcome, Nicole. And Nicole, if you're speaking, we cannot hear you.
Hi, sorry.
There she is.
Good to see you guys. I've been so excited for this event. So it's nice to hear about everybody else's company as well. So again, like she said, I'm Nicole. I do the recruiting. So I just want to talk a little bit about our mission statement, you know, our core values. I think that's huge for some people that are looking for jobs to really understand that. We hire the best people. We train, we empower, we inspire them. We can teach you all of our processes, but we can't teach attitude. I look for people that have that good energy, that are, you know, they want to work with the patients. They're still passionate about, you know, they still have that empathy because we have a lot of people that are hurting. So we have a great culture. You know, we believe in having fun while you're working. It's really working together, that team approach. Patients care. We place patients' needs above our own needs, but still taking care of that, you know, mental health that I think is important, because if we can't help ourselves, we can't help other people. And then community partnership. We take a lot of time spending in the community, lots of great events that happen that we're a part of, and we can go on there. So there's so many services we offer here. We have inpatient, we have outpatient, substance abuse. We do have a special needs program where we specialize in autism on that unit. Sometimes we do first responders at our Glendale facility. So there's just so many options. We have ECT. We do a lot of great things like equine therapy, adjunctive therapy. So we keep our patients busy and engaged while they're going through such a hard time. So we want to be able to give them hope and strength and still, create a great positive environment for them. But this just kind of goes over what we do. We have 2 different locations here in the Valley. So we have one on the west side, we have one on the east side, Tempe and Glendale. So I recruit for both of them so I can, in the breakout rooms, figure out who's looking, who lives more at Glendale location, Tempe location. And then we can move forward on that. The open positions, this is the fun part, right? So if you see any of those positions, we might have a little bit more. So in those breakout rooms, we can talk about it. Behavioral health technicians, you do not have to have a certificate or a license. You have to have a high school education, GED. We can train you if you're good with people. And again, you want to help people. That's something that we can bring you into those and train you. We have great people here that we like to take in, people that are still really excited and motivated just to be around people and help anybody with addictions or psychiatric issues. CNAs, LPNs, RNs, therapists, licensed and masters prepared. So you do not have to be licensed for we have several departments in our outpatient and our social services department, our intake. So please keep that in mind. Housekeepers, dietary staff, maintenance. We've also do a lot of promotions within. So we've had tons of people go and move up in our facility if they come from entry level positions. So we can move forward. And I am the recruiting manager. So you have my information. You can email me directly. You can go to our website. All of our jobs are listed on Indeed, but you can absolutely reach out to me. And I'm looking forward to meeting you guys in the break room. So I hope you enjoy the rest of this.
Fantastic. Thank you, Nicole. All right, we're going to move on to our good friend, Roger. Welcome, Roger Adams. He is a regional talent recruiter with CVS Health. Hi, Roger.
Morning, everybody. Always pleasure, Jessica, for having us on board. Thank you so much for this great opportunity to touch base with some great candidates out there. I've been direct messaging some people already, so awesome. I'm with CVS Health. We are the 11th largest employer in the state of Arizona. I've been doing drugstore for 23 years, and a lot of you that have touched base with me in the past know I'm pretty passionate about this. If you talk about CVS Health, we have over 300,000 employees in the US. And last year alone, we hired 30,000 people in a 3-month period just to meet the needs of the COVID outbreak. We are the largest single entity that has brought us back to normalcy, let's say, with COVID testing and COVID vaccination. We are Fortune 500's 4th largest company. What's kind of fascinating about what we do, and people kind of think, oh, it's a drugstore, great. 1 in 3 Americans use our services every day. We were voted one of the most respected companies in the US, and we are the largest US-based healthcare company in the world. So yeah, we're small, but we're big at the same time. Next slide, please. Obviously, CVS Health is where I'm with. These are some of the names that are with us. Aetna Insurance, the 5th largest insurance company in the US. Omnicare, Caremark, Quorum, obviously our mini clinics and our stores. So when we talk about healthcare and social services, we're kind of the Swiss Army knife for the whole business. Everything you can think of and then things you never have. We have opportunities, work from home and in-person roles right now. Next slide, please. Currently, we are looking in the retail side and in the stores for store managers, pharmacists, nurses, supervisors, associates. What's kind of neat is our pharmacy technician program. We've talked about some CNAs with some other employers. We will get you nationally certified as a pharmacy technician. And what's neat about that, it's more of an apprenticeship job shadow than it is going to school. You come to work, we onboard you. Some of the same conversations we were having with some other employers, some comments out there was, if you have a smile, you have customer facing opportunities, we'd love to get you upskilled and take those great gifts that you can bring to the table into our stores. What's neat about all these positions though, as being as big as we are, you could work for CVS Health through these different companies, do these different divisions nationwide in a work from home role or in another role, you could have 8 different jobs and never leave our business. Next slide, please. If we could, next slide. Okay, we'll do one more. Right now and I did this update again today, there are 1,800 jobs available in our website. I'm going to post in the contest and in the breakout room all the current openings plus the remote ones. But again, we're looking for nurses, pharmacists, medical coding, billing, call center operators. If you've ever done anything medical in any background or had an interest, we would love to onboard you and give you 5 promotions in the first 3 years you've worked for us, because we're looking for talent, skills. You bring your game, we recognize it. You got game. Let's upskill you into a career that's life-changing. And I'm really excited to meet everybody in the break room, guys. Thank you so much for inviting us, Jessica. My information's on the screen. Please reach out on LinkedIn. I live on the thing. A lot of you have had me direct message you over the years. Please connect with me. Posts are always going up on job openings individually, and I can be a resource and a clearinghouse for any role you see on our website. Let me get you in touch with a recruiter or a hiring manager per role. I love to be a help on that. Thank you again so much for your time, guys.
Thanks, Roger. I think you have the line of the day so far. Do you want 5 promotions in the first couple years? That's awesome. Oh, you went back on mute. But yes, I know there's tons of opportunities, and Cvs Health does great work in our community. Thank you so much, Roger. I remember when you contacted me, I think it was earlier this year, maybe last year, and you're like, we have so many jobs, I don't even know what to do with myself.
Yeah. And it hasn't changed, guys. We filled a large chunk of them, and you know what? There's more growth. Obviously, the Arizona market is red hot in healthcare. But honestly, if you've ever had a decision, it's time to make a change or even a hobby hustle, let us bring you on as a part-time. We're open 365 days a year, 24 hours. We can be your side hustle, and it might be the next great opportunity for you.
I love that. Thank you so much. All right, we're going to move over to Sonia Mae. She is a director of talent acquisition with RadNet, another new company I hadn't been familiar with before. So welcome, Sonia.
Hi, hello, good morning. So I am the director of talent acquisition for the West Coast for RadNet. And RadNet is the parent umbrella. It's a national company that is the #1 provider of outpatient radiology services in the nation. We actually do business as Arizona Diagnostic Radiology, which some of you may have seen or heard, because we have 8 different locations in Arizona alone. If you can jump over to the next slide for me. If you've never heard of RadNet before, again, like I mentioned, we're the #1 provider of outpatient radiology services in the nation. So we are across 8 different states currently. We have over 350 centers. We have over 8,600 employees. And in Arizona alone, we have 8 centers. But across the West Coast, we have over 150 centers. And right now, we currently have over 1,000 positions available nationally, and our positions are very broad. We have anything from really our healthcare positions, which are going to be our radiology positions and their technical roles. So you're looking at, positions such as an X-ray tech, an MRI tech, an ultrasound tech. If you're in that field now, we have tons of positions in those areas. And then we also have our administrative positions as well. So you're looking at the front office, our call center team, anything for our business related positions, whether it be in IT or accounting or HR, we have those opportunities available as well. And we were really happy to be asked to join today to be able to share about those opportunities. So if you can go to the next slide, you can see a list here of what is available in Arizona, which is this slide here. So these are some of the opportunities that we have. As you can see, we have anything from full-time to part-time to per diem opportunities. A lot of people on the call today talked about work-life balance, and I will tell you, we do the same, because we're an outpatient radiology center, we have very flexible schedules. So typically we're running anything from, as early as 6 a.m. in the morning, anything to, 8 o'clock at night. but we have a lot of different types of schedules that are available for our employees so that they have that work-life balance and they know that they have a set schedule. We also do not offer on-call, and we do not offer weekends unless that's the shift that you are open to. So you always know kind of what schedule you're running into and what you want and what you're looking for. So I always like to point that out. As you can see here, these are some of the opportunities that are available. On the previous slide, it looks like we had our slides are mixed up here, but on the previous slide, if you can go back, you can see here a snapshot of all of our opportunities that we have, all of our benefits that we have. And we have a very comprehensive benefits package, like I'm sure many of you many of the employers had mentioned. But one of the areas that I always like to point out is that we not only have healthcare, vision, and dental benefits, but one thing about our health benefits is that it's employer paid. So on one of our plans that we offer for our medical benefits is employer paid, which means the company pays for it at 100% and it's free to our employees. For our part-time benefited and full-time employees, we offer a lot of career advancement, cross-training opportunities, and then most importantly, we offer tuition reimbursements, employee referral programs, and we also provide free radiology services to all of our employees and their families. So anytime you need an X-ray, an MRI, or a CT scan, at any of our facilities, our employees do get them for free. They are covered along with their immediate family members. And last but not least, because we are a nationwide company, I always like to tell everyone that even if you start your career here in Arizona, let's just say your life is changing or moving, and you are finding yourself having to go to California or New York or Florida. One of the things that's great is that you can easily transfer to any of our locations out in a different state if that's where your life takes you. And then we, for anyone that is a technologist that's on the call here today, participating, whether you're an X-ray tech, an ultrasound tech, I also want to share with you, with those individuals, that because we offer a lot of cross-training opportunities, it gives us an opportunity to really advance everyone's career. If someone is an X-ray tech and let's say they want to move into a mammography technologist position, what's great is that we pay for our employees to be able to continue that education and receive those additional licenses. So I always like to point that out and want to make sure that everyone's aware of that. We're really invested in really helping individuals grow in our organization and really learn and really have a career with us. So other than that, on the very last slide here, this is our contact information. That is my email address there. I'm also on LinkedIn. Please don't hesitate to reach out and connect with me. I will definitely respond right away. And then I also have our talent acquisition partner, Blair Brown, who actually oversees the Arizona market, who's also on this call and will be in our breakout rooms today. So if you have any questions, please don't hesitate to reach out.
Awesome. Thank you so much. We appreciate you being here today. All right, we're going to move over to Dignity Health. Dustin James is a senior recruiter. Welcome, Dustin.
Hi, good morning. Good morning, everyone. Thank you so much for the opportunity to share with you and for being here today. Again, I am Dustin James. I'm one of the senior recruiters here supporting our ministry here at Dignity Health in the Arizona market. Next slide, please. Dignity Health is part of Common Spirit. They're our larger organization name that was created through a merger with CHI Health and Dignity Health in 2019. We do now operate over about 142 hospitals and more than 700 care sites in 21 states throughout our ministry of Common Spirit, being one of the largest non-for-profit health systems here. So a lot of room for growth and opportunities within the organization just outside of Arizona as well. So if Arizona is not the place that you're looking for, or if, again, life changes and needs to take you somewhere else, we do have lots of opportunities across the Common Spirit Health organization. Next slide, please. So our Arizona locations, for our Arizona market, as you can see on the slide here, we have about 6 outstanding hospitals, just welcoming the Yavapai location in 2021, December of 2021, and then lots of multiple freestanding emergency rooms throughout the valley as well. Next slide, please. So just a little bit about us. Here in the Arizona market, we have a team of more than about 10,000 caregivers and staff who are committed to providing exceptional care through the communities. Of course, as our common spirit kind of in Dignity Health, through Dignity Health, our mission is to look to make a healing presence of God known in our world by improving the health of the people we serve, especially those who are vulnerable, while we look to advance social justice for all as well. Our overall vision is, of course, to create a healthier future, inspired by faith, driven by innovation, and powered by humanity. Next slide, please. Just a quick brief overview of our benefits here. Just, a lot of things as some of the organizations have mentioned. One of the things that we do take pride here in is we have a great wellness program, and I know a lot of others have mentioned work-life balance, and that's something that we look to promote here and really the well-being of our employees. So a great wellness program here in addition to the other amazing benefits here at Dignity Health that we do offer, and would love to answer any questions in addition about our benefits in the breakout rooms as well. Next slide, please. A lot of career opportunities here at Dignity Health, as you can see, lot to offer for clinical and non-clinical roles. We'd love to find a good fit for you and find a home here at Dignity Health. We also do have remote openings, and those are also very easy to filter out on our career site. So if you're looking for a remote role, we do have those opportunities available as well. I really, again, appreciate you guys being here this morning. I look forward to connecting with you in the breakout rooms as well. And I've also put my contact information there in the chat along with my email address. So if you do have any other questions or can attend the breakout rooms, I would love to connect with you. Thank you so much.
Fantastic. Thank you so much for being here today, Dustin. All right, this is our last speaker, you guys, our last company speaker. And so Sarah Ruth is the marketing manager with LifeWell. Welcome, Sarah.
Hi, everyone. We will make this short and sweet so we can get you to those breakout rooms. Like Jessica said, I'm with LifeWell, and we are one of the largest nonprofit organizations here in Maricopa County that serve low-income adults who are looking for anything mental health treatment related. Maybe they got some substance abuse issues going on. Maybe they want some counseling, whether in person or telehealth. Basically anything other than inpatient, we're all about it. So we'll go to the next slide and I'll share just a little bit about our programs. We're talking, that integrated healthcare model. We have doctors, we have nurses, we have medical assistants. We also bring in the peer support piece and the counseling piece, of course. We also are one of the largest housing providers in this space as well. And a lot of people don't know that. So we help link people with maybe SMI or a background of addiction who are trying to get back on their feet. We help link them to housing, and we all know that's very key right now. That's part of your treatment, right? So we're really proud about that. We really like to be that one-stop shop for low-income adults. We'll go to the next slide, and let me talk a little bit about our company culture. We are all about training and mentoring from day one. We love appreciating our staff. We just actually wrapped up our 2022 Appreciation Week. You see some pictures there. We had a lot of fun with it with Spirit Week and handing out a lot of gifts and raffles, and we just had a really good time. We also are really known for promoting from within. So we want you to start your career or advance your career with us, and we have many positions that will allow you to, maybe explore something that is something you've always wanted to do, but you haven't had the chance to. So we love doing that here at LifeWell. A few reasons why you'd want to come and work with our team. We have a ton of bonuses right now. So in the breakout room, if you want details about that, come on by, especially for nurses and licensed therapists at several of our locations. We're in West Phoenix, Central Phoenix, we're in Mesa. We also have a lot of those growth and development opportunities and a lot of employee wellness programs and rewards. Of course, great PTO and competitive benefits. And we do have a lot of flexible schedules. We have several residential programs that are 24 hours. So if you're looking for something that's more on the night shift side, we have a lot of different opportunities for you. Just a few last things. The positions in green are our more medical type positions that we're hiring for. And then the ones that are in coral or red, those are more clinical. So everything from peer support specialists and substance abuse counselors to case managers, that overnight support staff team, and of course, residential program managers as well. We also have some front office positions. I don't necessarily see them on the slide, but I know we have some open. So if that's more your speed, come join us. You can email me. You can visit our careers page. I will. Yep, there's a slide. Perfect. Thanks. I'll also put it in the chat. Let me also just put my email here, and we'd love to bring you on board. So thank you so much for the opportunity, everyone.
Awesome. Thank you so much, Sarah. All right, you guys, you heard from these amazing employers. We're going to go into the breakout rooms in just a minute, but we do have an incentive for you all. We're giving away 4 $50 gift cards. And the way that you can do that is by completing a quick survey. Check out the chat. Bree or Joey are going to drop in the URL right now for the survey. And so once we drop that survey link in, there you go. Click on that link, go fill that survey out right now. And when you in the survey, it's going to ask you at the bottom, if you want to include your name and cell phone number, that's how we're going to notify you that you won. And so it's essentially anonymous, but I know you're putting your name and information out there. We're not going to publish anything that you guys said. So please fill that out. Let's just sit for a minute and let people fill that out. After you're done filling it out, if you could come back in the chat and just drop done, that will help us know how people are doing with the survey. The reason we're having you do these surveys is because this is a grant-funded project, and we want to continue providing these programs for free. And the way we do that is by getting data. And so we are asking employers to also give us data. We're asking attendees and job seekers to give us data. The more data we have, the more that we can go out to our grantors and show them the impact we've had in the community. Thank you, Donna. Thank you, Mary Beth. Thank you, everyone. This is fantastic. Thank you, William, Lauren. Thank you, guys. So go ahead and click on that link, the survey link, go out, fill it out. It will be up until tonight. We will then pull the winners tomorrow morning. And so you will be notified via text message. And it'll say, hey, you want a gift card? We'll probably ask for your, we're either going to send you an email or send you the actual gift card and in the mail. And so it's not spam. If we say, hey, you want a gift card, it's not spam, it's real. And we will get those out to you in the next couple days. So again, the survey link is dropped in there. If you could fill that in and then include your name and cell phone number, and we will make sure we pull 4 winners from that. The other thing we're asking is in about 6 weeks, we're going to be sending out an email to you asking if you've landed a job, if you've connected with with any of the employers, and if you've landed a job. We would love for you to fill that as well. And for that one, we have been also giving incentives. Typically, it's Apple AirPods Pro as our incentive for answering. And so you just have to fill that survey out, give us some data, and we will be giving raffles out. And so that's really fun to give out because the Apple AirPods, we've been engraving them with the name of the winner, and it's just fun. So we love to do that. All right, I want to thank our education partners on this event. The education partners will also be in the breakout rooms. So we have DeVry University here, Gateway Community College, and the U of A, University of Arizona. And again, some of these programs that they have are their degree programs and associate programs and certification programs. Some of the programs are also available to be funded through federal dollars. And so they can walk you through some of that as well. All right. Couple resources that we have for you guys. Just a reminder, the recording is live. We'll be live tonight. We'll get that uploaded. And then just some additional resources Career Connectors has is we do offer a DISC assessment to anybody that is going through Career Connectors or AZ Careers now. And you can get that on careerconnectors.org/DISC. And that will just tell you a little bit about your strengths and your ideal work environment, things like that. And you can incorporate a lot of it onto your resume. We are all over social media and would love to engage with you guys that way. We put out some tips and tricks around job search and around LinkedIn, etc., on our social media platforms. All right, so our upcoming schedule. Every month we do a schedule or an event, a virtual event that is content heavy and has coaching available. And so the next one that we have that is content heavy is Thursday, August 11th. Numb and Dumb, what nobody's telling you about your ailing job search. This is a virtual event. Christy Staub is the speaker. She is phenomenal. And then we have professional coaches available for one-on-one time, LinkedIn, career coaching, finance, professional resume writers, all available at that event. And then our partnership with the Greater Phoenix Chamber Foundation is on our next event is on August 25th, where we're doing a similar version of this, but for the finance and insurance industry that is also one of the top 5 growth industries in Arizona. So you'll see we have about 15 companies currently booked, and we'll have around 20, but American Express, Charles Schwab, Freedom Financial Network, we have Liberty Mutual, and on. USAA, all the big ones are going to be there, and we're going to sprinkle in some of the smaller ones as well. And then one of our most attended and desired events of the year happens twice a year, and that is on Thursday, September 8th. September is coined Update Your Resume Month. And there are so many ideas about what makes an ideal resume. So what our professional resume writers do, we will have a panel and I will be interviewing them, but their goal is to help market you and get you seen in front of the recruiters and hiring managers and getting through the applicant tracking software. And so that event is on Thursday, September 8th. We are muting here. Okay, there we go, got her. All right. So we would love for you to be involved in that. And now that you're registered for this event, you will get our weekly email that talks about the upcoming events that are available. And you can see all of those on our website, app.careerconnectors.org/events, or you can just go to careerconnectors.org, or you can go to azcareersnow.org. So .com. There's multiple ways to get to the programming available. And that's our QR code if you would like to utilize that. All right. Now, we are going to move over to the breakout sessions, and Bree is going to walk you guys all through that. And I just want to let you all know that me and my team, we're so honored to be here and to be serving in this way. We are available to you, and we are always praying that you land into the career of your dreams. Thank you so much for being here today.
Hello, I'm going to go over how to go into a breakout room really quickly. So in just a minute here, I'll open all of the breakout rooms. So you'll see a list of them. Whichever breakout room you want to join, you'll just click join, which is to the right of each name of the breakout room. Once you're in there, you can always have the option to come back to the main Zoom session or go to another breakout room. And if for some reason you can't get to a breakout room, just let us know in the chat and we can manually put you in there. All right, so I'm going to open all the rooms now. There we go.
Awesome. Thank you, Bree. All right. So you should be able, employers, you should go ahead and jump into your rooms. You'll just click on the join button. And great. Looks like those are filling up. Awesome. And then candidates, attendees, go ahead and open your chat or your breakout rooms and you can start joining the different rooms. You may visit multiple rooms. So you can go from one room to another, and we have about an hour to do so. If for any reason you have trouble joining a room, drop it in the chat and we will help you, guide you to the room. Sevi, if you take a look, if you're on your computer and you look at the bottom bar, there should be options there that say like chat and participants. There is one that says breakout rooms. There should be. Sometimes if you don't have the current version of Zoom, I know that it can be funky, but there should be something that says breakout rooms. If you're not seeing it, well, click on it and then you can hit join. If anyone's not seeing it and having the ability to go into the breakout room, just drop in the chat where you want to go and we will send you there. Great, great.